So we get a referral for a patient for pulmonary rehab, and these are the things that we're going to do with them. So we bring them in for an individual assessment and learn about their disease process. We learn about what they're having trouble with, what their goals are. So basically, this can be an hour to an hour and a half session where we have patient interview, and we do a synopsis of their medical history, including their breathing history. We want to know about their comorbidities, their oxygen use, their smoking history, physical assessment, including vital signs, SpO2, height and weight. We use, and most programs use, a 6-minute walk to determine exercise capacity. We also are looking at their saturations, their perceived exertion. We do that pre and post program. We review in our written ITP the diagnostic tests, including their spirometry and their PFTs. Again, we want to have a patient that has a diagnosis of COPD, mild to or moderate to severe persistent, and or severe, and so that we can fit the Medicare criteria on that. We want to have a symptom assessment. The most common ones that are used are the COPD assessment tool, and that kind of looks, patients self-report their symptoms, and the MMRC, which patients will rate their shortness of breath as in a category of 1 to 4. We look at pain. We ask questions about their activities of daily living. What are they having trouble doing? What do they like to do for fun? And one of the things that we use for that in our program is the Dartmouth Coop survey, but other ones can be used. A nutritional assessment, educational assessment, including the understanding of disease treatment and learning barriers. There is a nice true-false questionnaire in the AACBPR Pulmonary Rehab Handbook, and or you can make up your own. A psychosocial assessment. There are a variety of different ones out there. Our program happens to use the PHQ-9. Multi-component assessment, the BODE, B-O-D-E, and the BODE compares 4 components: BMI, FEV1, dyspnea using the MMRC, and exercise capacity. And this BODE is a strong predictor of mortality. And then we also look at the patient's perceived exertion and how that relates to maybe their 6-minute walk. And we develop goals for that patient. Maybe it's they want to breathe easier, be more active, improve their ADL abilities, reduce their anxiety, decrease exacerbations and hospitalizations. So we always have asked the patients, what do you want to achieve from pulmonary rehab? And then gel what we think they need and come up with some goals in that ITP. It's a good idea to go through those goals during the program to see if they're making progress into meeting those goals and then readdressing things that they're having difficulty with.